Thank you very much, sir. I think there are two new people here, and you have the advantage of knowing each other, but we don't know you. So over the rest of the day, hopefully we will get to know each other, but we decided we are not going to go around the room introducing ourselves. Thank you so much, Giovanni, for introducing us. And so you know a little bit about us, and we will keep talking and explaining a little bit more about what we do. And we'll bring through today some of the stuff that we actually have been involved in and in working with. Okay. So I hate this talking from a lectern thing. I'd much rather be down there, but we are told we have to stand here and talk to you and use the mic. So the first thing we'll do is take you through the outline of today. It's a very long day, and I'm surprised you've survived 2 days. Hopefully you'll get through the third one. We will have a lot of interactions and small group discussions, but this is the rough format. So initially, I will kick off, unlike what the program says, because Anki was going to do the whole day and I was going to go home. But I will do the first session, which is finding out a little bit about what do people really want to know about. Okay, I know you've been looking at qualitative research and quantitative research and looking at critical evidence, and actually I'm going to deal with a little bit of the soft stuff, not the real, hard research stuff. So what I'm going to first focus on is what outcomes do young people, children with disabilities, their families want? What are the research priorities for them? What are the research priorities for professionals? And the professionals do not just include healthcare professionals, but include professionals across the board working with children and families with disabilities. Because that then will help us look at some of the other questions that arise. Okay. Now, the other thing in the first part I'm going to cover is what are the training needs that professionals talk about? And that, again, will help us decide what are the research questions we should be asking. Okay. The second topic is very ambitiously called the Toolkit of Foundational Concepts. We were trying to decide who came up with that title. Anki and I didn't, but we would hope to cover some of the philosophy and principles which are involved in current practice in childhood neurodisability. Okay. We have a break which is included in that bit, and then we will move on to some of the actual tools. So we would be talking about what are the right tools, how do you choose the right tools to answer different questions, and that session will go across to the second half of the day, so across lunch. And then we'll spend a little bit of time talking about how to develop a research tool. And we will be using the example of the MAX. Most of you are familiar with the MAX, and we have Anki, who has been integral to the development of the MAX, and we'll have a session around that. And the last session of the day will be around goal setting in clinical practice, using some of the tools and working through some of these. So all of these would involve a lot of work from all of you involved in small groups. We recognize this room isn't the best for working in small groups, so we probably will be utilizing a lot of the rooms and maybe the outside space to work alongside each other. Both of us will be around through the whole of the day, and the way we will work it is unlike the first 2 days. We will be kind of working with you through the groups and flitting from group to group, and that's the way we will get to know all of you, and you'll get a chance to ask questions. At the end of the day, we are hoping to have some time where we are going to have some interactive sessions, just free-flowing interactive sessions regarding questions and discussions as topics emerge. Okay, I want to spend 5 minutes just exploring what you want to get out of today. Now, I'm sure all of us, including you, sir, I've put the first one up, which is we want our coffees and lunch breaks at the right time and get the breaks in. And we might actually have a little few more breaks in between as well. But you know now the outline of the day, but it might not actually be covering some of the things that you thought might be included in the day. So are there things that any of you would like to see or discuss through the rest of the day, which we can, put in a parking lot, and then we can come back to during the discussions and pick up as we go along? Veronica. Hello.
Hi. If it's possible, I would like to learn about how to validate assessment tools that already exist, but we cannot use in non-English countries like Spain, because we have a lot of work for validating tools that we need.
Very important question. I think that's one of the issues which I will bring up as we go along, and a very important one. Yep. We certainly will talk about that. So did everybody get that? So how do we validate something which has been developed in one part of the world, but how do we know it is valid for the language, the culture, the population that you're going to apply it to? Any other thoughts? No? Quiet. Okay. As we go along, you had a question? Yeah. Can you say who you are? So, Ankia, I know.
Olena, sort of around the question that was just brought up. The best ways, so related to the issue that just was brought up, translating tools. So the pathway to translate tools, because there are recommendations there that vary on how to translate a validated tool into a different language.
How do you translate tools?
Yeah.
And are you talking of linguistic translation, cultural translation, or all kinds of translation?
I'm talking about linguistic translation of assessment tools,
okay,
outside of course, language assessments, because that's a different...
Okay. So it's an extension of, partly an extension of that question. Yeah. I'm going to jot these down as we go along.
Yes, it's sort of, I don't know if that was involved in your question, because, but it's how you adapt tools that are not appropriate for the age, maybe, or if you have children with cognitive disability, how could you, what do you need to think of that could be the problems with this tool? So first, sort of trying to find what you need to think of, if this tool will work or not, or if you think it won't really work, like how can you adapt it so you can use it with the population?
Yeah. I think very important questions, because one of the greatest challenges is that most people often don't realize the limitations of tools and use a lot of the tools inappropriately. So how do you make it valid? Anki, you've got your job cut out for today. Any other thoughts? No? So, as I mentioned, we'll have a parking lot. This is the parking lot. So as we go through the day, if you have more questions, just either tell one of us, or I'm going to keep this paper down here. So you can just add your list of questions to it. And hopefully we will have enough time for discussion at some point through the day, either in the middle or right at the end, where we pick up some of those and discuss further. Okay. You have a reading list, and most of them do require your password. We do have, I hope we do have, one which is going to be without a password, something printed. So it's a chapter out of a book, which is not published as yet. So please do not share it. It is for your own personal consumption. We'll be in breach of copyright if you do share it. It is for the last session of the day. So we have lots of time. But I know that Giuseppina was going to print them and keep them. Oh, you have them already? Wonderful. Okay. We don't have them. You have a copy, Anki? I haven't printed 30 pages. You have a copy. Everybody except me has it. That's good. Has everybody got it? Some people are looking a bit worried. It is around the goal-directed, goal-setting exercise. Yeah? Okay. You don't need it. You don't need it for the time being. It is just that that is the only thing which is on paper. The rest of them are on their internet resources. Can I check, does everybody have a laptop or some device you can connect to? How many people don't? 2, 3. So most people have access to the laptop. And do you have passwords to get onto them? I haven't been able to get a password from anybody so far to connect on. But because as part of the discussions, one of the things you might require is access to the internet to look up some stuff and for your discussions. So if you don't have a password, it'll be not in the first session, but later on in the morning we will. Okay, thank you very much. So we'll kick off with the first session of the day, which is looking at what are the priorities. Somebody's sneaking out. Okay. So the first session, we are going to be looking at what are the priorities. And the priorities talk will have 2 sections. So one is, what do people really want for themselves? What outcomes do young people and children with disabilities want for themselves? What outcomes do parents of children with disabilities want for themselves and for their children? The third thing we will look at is what are the research priorities as identified by young people, professionals, everybody working together. And then some of the research priorities identified by professionals without parents or young people. Okay. And the last bit of what we are going to cover is what do professionals and practitioners in the field, what kind of training do they want? What are their training priorities? And the reason for looking at the outcomes, the training needs, and research priorities is that because that hopefully will change some of the perspectives in how you go about formulating or finding your research question. And I may be wrong, but generally what studies suggest is that most of us, when we are choosing a research question, that research question is not necessarily based on a consensus with families, young people, and things. It's based on a biomedical model. And it's usually in the department that we are working, what that department's main area of interest is, and we kind of become sort of involved in the studies and things that are going on, rather than it being based on what priorities are there in our field. And this cartoon actually exemplifies to some extent the nature of the problem. And what it says is, this elderly gentleman is reading the newspaper, and it says, "This spectacular new medical breakthrough is of such fundamental and far-reaching character that no practical benefit is expected for the next 60 to 80 years. And sometimes the research is looking at what we want to achieve, we think is going to be important, and often it is based on cure models. But it does not necessarily address the here and now, what the priorities for the children and the families are in the immediate context. Yeah? So it's getting that balance right. It does not mean that that kind of research is not important. So I'll give you an example. For example, we are actively very excited to be in this field because this is probably the most exciting time in childhood disability research, because a large number of conditions, we are understanding the genetic basis, we are understanding the neuroanatomic basis, and people are starting to talk about the C word, the cure. Yeah? How can we genetically modify things? How can we actually cure the brain? Can we repair the brain? Et cetera, et cetera, et cetera. But I think we all know that this is not going to happen tomorrow. It's not going to happen in the next 2 years, 3 years, 5 years. Possibly, yes, within your lifetimes, possibly. Yeah? So it's an important goal, but what about the here and now? We also need to address the things which will affect the lives of children, young people, and the families within the next 3 years, 2 years, 5 years, whatever. Okay. So these are the learning outcomes from this session. By the end of this, hopefully, you will know and understand a needs-based research approach, what outcomes are important for disabled children and families, know about the different research priorities of disabled children, young people, families, service providers, and practitioners. Know a little bit about the global knowledge transfer priorities, and this is the teaching, training priorities across the globe. And part of the time we will also spend reflecting on how it influences your research priorities and the research questions you will ask going forward. At least that's what we would hope. So you've got in this cartoon part of the ulterior motivation which Anki and I have for today, which is influencing your research. So this NIH grant guy is saying, you're completely free to carry out whatever research you want, as long as you come to the same conclusions that we are expecting out of you. Okay. Okay. So most of the information and the data that I'm giving you are in the different reading materials which already you have had. And some of you already probably have explored that material. So the first bit, we are looking at the outcomes approach. The outcomes approach is very difficult, not only for us as clinicians to grasp sometimes, but also very difficult for families to grasp. Exactly, because we are quite often more focused on the answers to research questions than what the outcomes might be. So these are the things that young people with disabilities prioritize for themselves as positive outcomes. Being healthy, and what does being healthy mean? Means having a sense of well-being. So it is not the absence of disease, which was the old concept. So being healthy is having a sense of well-being, being pain-free, normal lifespan, positive emotional health, easy access to healthcare and support.
What does normal lifespan mean?
So they would hope to have a life. So currently, if you think about how long would you expect to live? A child being born today, how long would you expect them to live? It depends on the context that you're living in. So the normal lifespan for a child being born in Italy is going to be very different to somebody who's, say, being born in Rwanda.
But it means not to die in the house.
It's, yes, having a normal lifespan for the context. Not necessarily applicable to everybody. These are norms-based, and I'll come back to that question when we are discussing norms. Okay. Being able to communicate, staying safe, having friends and interests, being accepted within peer groups and being able to communicate with them, have fun with them, and being part of the local community. Acquiring social and self-care skills, being independent, and then feeling confident, respected, experiencing success and achievement. Now, what is interesting about this list is when you look at the children without disabilities, or typically developing children, that list is roughly the same, except one. Can you guess which one? It is one which typically developing children take for granted. Pardon? No, it is being able to communicate. The communication thing, people because it's part and parcel of your normal developmental process, but that is one of the key things that children with disabilities value highly. So there are some qualifiers to that statement, which means give some additional information to make sense of those statements. Some of those are considered to be fundamental or core outcomes, which you need to achieve before you would hope to strive to achieve the higher outcomes. So which are the core outcomes? Those are the first three. So if we go back to them, the first three being healthy, being able to communicate, and staying safe. Because if you do not achieve those three, experiencing success and achievement, feeling confident, etc., those become much harder to achieve. Yeah? So for them, you need to achieve the fundamentals before you go on to the higher outcomes. As we've mentioned, these are not particularly different from typically developing children. These are norms-based, and that goes back to your question, which means, what is a normal lifespan? Yeah? So it is in the context of that child's condition and in the context of that child's circumstance. So for example, we were mentioning that if you are born today in Italy, it is going to be different to if you were born in Rwanda or in India. So each place has its own context in terms of lifespan. Similarly, each condition, each biological condition has its expectancy in terms of lifespan. The same thing applies whenever you look at different areas of functioning. So what it is talking about when I say that I want to achieve the best is that it means you want to achieve the maximum potential which your condition, your biological condition, and your context allows you to achieve. That is what they want. So it is norms-based. Does that make sense? Okay. So outcome priorities will differ across different conditions. And what is also very important to recognize, we were saying we were going to look at what disabled children want for themselves and what their parents want for their children. And what parents want for their children is no different what the children want for themselves. So those are the outcomes which parents want. And if you think a little bit further and extend it, for those of us who have children, once you reflect back on those outcomes, those are the outcomes which we want for our children, our own children. Yeah? So there is no great difference in that. There is a caveat, and the caveat is that there are slightly different priorities if you have a life-limiting condition or a regressive condition. Yeah? Then, in terms of the children's priorities and also the parental priorities, there is a slight difference in what kind of outcomes they're wanting. And there, it is wanting to retain a lot of the skills, retain a lot of the other abilities that a child has, including lifespan. The parents' desires of outcomes for a child who's dying, so this is slightly different to a life-limiting condition. So most of us know that a lot of the children, and we are coming into contact with on a daily basis, might have a life-limiting condition, but they may live for many, many, many years. Yeah, a child with a level 5 cerebral palsy, they might live for another 20 years. It's a life-limiting condition. But this statement is particularly in relation to children who are actually dying at that point, so they have less than 6 months for definite of living. So those priorities for parents are, they need to be pain-free, anxiety-free, they need to be surrounded by familiar and loving people, and they need to be in a familiar place. Those take on the priorities, which is not a surprise. That is what I think, once you reflect, that is what all of us would want. Okay. So we've talked a little bit about what the children want as positive outcomes, what parents want as positive outcomes for their own children, which is similar. So this question is slightly different. It is, what do parents want as positive outcomes for their parenting role for themselves? Okay. And this kind of relates a little bit to some of the stuff you've already covered around family-centered services. Was that covered in the first day or so by Jules? No? Okay, we'll talk a little bit more about family-centered services. So as parents, we know, talking to parents, sometimes they feel that they have lost their identity. They have become someone's mom, someone's dad. Yeah, that's how they are referred to within, contexts of conversations, within meetings. So this is Jack's dad, this is, Trudy's mom. That's their identity. They want to maintain their personal identity. And that involves a whole range of things, some of which are employment, independence, social activities, their own, groups, etc. The other thing that parents often tell us is that the process of caregiving tends to take over their lives. And that process of caregiving is so enormous sometimes that it does not give them quality time to spend with that child and that child's siblings. So they do want time where they are able to share quality time with that child, the other people, which is around having one of the things coming up later on, which is the shared experiences. People, all of us, want to be in control of our lives. And when you have a child with a significant disability, one of the things which you really get stressed about is if you do not know how to actually care for and provide support to the child. So if a child is in pain, in distress, they might come and tell you. Whereas if your child is unable to do that and you do not know how to actually alleviate the discomfort or the anxiety your child is feeling, that can be really harrowing and stressful for parents. So one of the key things that they want is feel informed and skilled in the caregiving task. They want to experience good physical and emotional well-being and not feel stressed all the time. Have a good family life with shared experiences. One of the things which research tells us is that the rate of family separation is way higher if you have a family where there is a child with a disability compared to where there isn't a child with a disability. And a lot of the research around looking at positive outcomes talks about families wanting support to maintain these parental relationships. And when we talk about research, one of the things, we don't know how to do that really. How do we support parents in maintaining relationships and things? So those are questions which will come up. Practical and financial resources, enough to meet needs. Again, there is sufficient research which tells us that the amount of time and resource taken up for caregiving usually results in one parent or even both parents either giving up work or reducing the amount of time that they spend in work, and therefore that leads on to a reduction in income, and there is a progressive downward slide towards poverty. Yeah? So there is a need for support, which is both financial and practical. Going back to the family-centered services, a key requirement by parents is a sense of partnership with the service providers. You want to feel that you are being well supported and you have a relationship with the people with whom you are working. And what does that mean, this sense of partnership? It means a whole range of things. You want to feel as equal partners, somebody you can actually talk to about, your priorities. And we know that, often most services feel that they do that. But the other day, one of my colleagues was saying, I've been doing this work for so many years, but actually I've realized I often, before starting the clinic, I've looked through all these records and I have in my mind what this consultation is going to be. And often when the parents are coming, they have their own agendas which might have no relationship to what agenda you have as the clinician. Yeah? So how do we develop that partnership of joint consultations? They want the practitioners to be knowledgeable. They want to have a good experience of the care, of that service provision. The service needs to be coordinated, have good communication, and of course, continuity and reliability of the service is important. Yeah. Another key thing which families feel are a major issue is sibling adjustment. So parents want siblings to be able to relate to the child who has a disability, have a relationship which is not based on a sense of missing out. So research shows that often if there's one child with a disability in a family, the family resources are directed towards that child. And the typically developing child might miss out on activities, on some holidays which the family cannot access because of the difficulties in going on holidays, or a whole range of things. So the missing out bit should not be there. That is what families want. And they want that sibling group to feel well connected. And part of the agenda is that if they are, then parents feel that they would have actually got some confidence that when these children are grown up, and when as parents we are not around, that that child will have a sibling group who are going to look after and look after the interests of the child and or the adult who will have a disability. So these are the desired parent or the caregiver outcomes. What do service providers want? This is relatively simple. And when we talk about service providers, we mean essentially two groups of people. And they may be the same person. So these are practitioners, like you and me, and managers. Yeah, people who are managing a service. And sometimes it is the same people who are providing manage, and in some situations it is different people. And when you ask people and you give them those outcomes of what people want, usually one of the responses you would get is, don't we do that already? Or the data response, we do that already. However, the reality is there is a spectrum of services. So a couple of years back, we ran a survey looking at the impact of austerity on different services and on families within Europe. And we did it through the EACD, and we went out to each and every country within Europe. And it was interesting because the level of need and the difference in service provision was so huge that it is now we have set it as one of the priorities of the EACD that we want to look at how can we actually level the playing field, because there's a huge gap in what is provided across the whole of Europe. Okay. So services across the board, everybody wants to help achieve the best outcomes for children and families. All of us shared that vision. Yeah. We want to provide family-centered services, and we want to sort of base our services on good evidence of what works. So we've talked about the outcomes that people want, and we are now going to shift the focus a little bit. So we are now going to look at research priorities, which is very different to what the outcomes are. What I would like you to do, though, is to try and see whether the research priorities actually are focusing on the outcomes that people want. Because ideally, that is what it should do. Our research priorities should map onto what outcomes the young people and the parents want. And if you look at what is called a business proposition, so you have this model of clients and you have somebody selling something to the clients. So you would want to serve up whatever your client is asking for. So if you apply that kind of transactional analysis to it, then really the young people and the families should be dictating the type of questions and the type of material that we are providing for them. So to do this, I have brought you two different studies. So this one, which is by Tomlinson et al., which is there in your reading list, looked at the global research priorities determined only by professional groups. Parents, young people were not part of this. The strength of this one is that it has people from all areas of the world. Different types of representation, and if you go into the study detail, it actually has a reasonably good structure to it of how the evidence was collected. Now, what it did was identify the most important research questions that people wanted. So they went out to different professionals across the globe, asked them to identify the up to five most important research questions they thought were, they wanted to ask. They collated all the data, then they identified the groups, the categories that they fell into, and then they went into this exercise of identifying priorities. Yeah? So the actual themes were based into 5 areas. And underneath these 5 themes, there are multiple research questions which were prioritized. I have not put out all the research questions. I've just given examples to give you a flavor. And within the article, you will find that there is a box which actually has those categories and the important research questions outlined. The important thing to realize is that these are identified as global research priorities. They are predominantly targeting middle income and lower middle income countries. It might not be as relevant to your own context where you're practicing, but it gives you an idea of what kind of questions, what kind of areas to look at. So the first group is what we would, in simple terms, say, early diagnosis and early intervention group, those type of questions. And certainly, those other type of questions often are more heavily researched. Did you get it? Excellent. So they are the more research topics we are familiar with. For example, what are the most important priorities for investigation and/or assessment for children with developmental disabilities in low-resource rural settings? You could take out the low-resource rural settings and apply your own context where you're working. See whether that question is answered or not. What is the availability, cost, and efficacy of early intervention and rehabilitation programs for children with developmental disabilities in low and low middle income countries? Again, you can just apply your own context. The second group is around health promotion and prevention. And these are the ones which are very rarely actually investigated. What is the variance in public attitudes across cultural and language groups? And some of these issues came out certainly within the survey that we did around austerity, that these are things which make a huge difference. Goes back to some of the issues that you were raising around culture, around language, and how do we adapt. Third group, looking at underlying causes. What are the causes of the different conditions? So identifying causes, prevalence, biomarkers, protective factors, etc. So examples, most common preventable cause of poor health in disabled children. And this can be in any context. Do we know what is the most common preventable cause of poor health in disabled children? What is the most important nutritional need? What would you prioritize? The fourth area is also under-researched, which is about health systems, improving access, etc. And health systems are notoriously difficult to examine and research. How do you best train non-health and health professionals? How would you best use assistive devices? How would you best use technology? These questions become even more difficult when you take this non-categorical approach. So you will notice that we are not talking about a specific condition. We are talking about children with disabilities across the board. it becomes slightly easier once you get down to specific conditions. So if the question was, how do you best use assistive devices in a level 4-5 child with cerebral palsy who does not have the ability to communicate, the question becomes more refined. So you have to then define your population. And the last category is probably being researched much more in the last decade or couple of decades, is about support for parents and families. But some of the questions are difficult. What is the best and most efficient way of supporting families? What are the most important causes of parental stress? And how best to support parental mental health and well-being? And not only are these difficult to research because you're trying to look at it from a service perspective, but actually the research process, and these are all qualitative research processes, and they are more difficult than quantitative research processes. At least that's what I feel. Qualitative research is more tricky. And I know you had a fairly heavy session on qualitative research yesterday. Yeah, I saw there were piles of stuff on the thing here. I had a heart sink when I saw that. Okay. Does that give you an idea? So these were professionals. These were the professional priorities on a global basis. Now, the other bit which I want to show you is the priorities, the research priorities, when you put together professionals alongside children, families, and charities or NGOs working in the field of childhood disability. Yeah? And what kind of questions you come up with and what research priorities you come up with. Now, I suspect most of you are familiar with this paper by Morris, Christopher Morris. And this was, in fact, a groundbreaking paper for most of us in the UK and possibly across many areas of the world, because it showed us that the questions or the research priorities can be identified. It's a laborious process, and if you go through the methodology of how they went about it, it took a lot of doing, but the end result was that they did manage to come up with initially the top 25 questions, and then by a process of prioritization, what is considered the top 10 questions. You will need to recognize that this was a UK-based study involving children, families, and NGOs based in the UK. And therefore, before you translate it to different parts of the world, there may be other priorities. The important thing to recognize is that there is similarities across these priorities and some of the outcomes that we were talking about. So I want you to relate back to those outcomes which people want for themselves and these questions. So what I've done is just given you the top 10 research questions. If you go into the paper, you will be able to see the top 25. I'm not going to read out the questions, but I've kind of highlighted the main areas that it covers. The first one is about effectiveness of therapy. And what is interesting about the first question is that in the top 10 questions and in the top 25 questions, this was the only question which every group had as number one. Yeah? This is the important question for everybody. And I think all of us relate to this one. Does the timing and intensity of therapies, any type of therapy, alter the effectiveness of therapies for infants and young children with neurodisability, including those without a specific diagnosis? What is the appropriate age of onset, the strategies, the dose, and the direction of therapy interventions? So within that, there are multiple questions. But this study was published in 2014, and already a large number of groups have started researching different aspects of that question. And this is probably one of the most important questions in our field. We need to get evidence before we can recommend, yes, we definitely need to do this, that, and the other. And we need the evidence for different areas of the world in different contexts and different populations. No surprise, communication-related research priorities was second. Third is friendships, yeah? Peer group relationships, acceptance and inclusion for children. Not, I suspect, a highly researched topic, but it certainly features up in number 3. Mobility. You'll notice that mobility follows communication, and often when parents come, there are 2 questions, isn't it? They'll ask, will my child talk? Will my child walk? You know, often those are the priorities. And this question relating to mobility, I think we already have some data to answer that question, which is, does appropriate provision of wheelchairs to enable independent mobility for very young children improve their self-efficacy? We have the answer for cerebral palsy. I don't think we have answers for the other groups. Mental health. Do counseling strategies work? What kind of counseling, etc. Issues relating to spasticity management. Continence, interesting, poorly researched. What works for continence? Number 8, active life. How do you improve activity, improve engagement, improve fitness? Inclusion, very important, applied across. So you'll notice that it is not just based on health priorities. We're looking at a biopsychosocial model. It's across everywhere. And number 10 is sleep. I think issues relating to behavior feature heavily in the top 25. It didn't feature in the top 10, but that again, alongside sleep, is one of the great priorities. When they were looking at the questions, one question which featured heavily also was around pain. And the reason it doesn't appear in the top 10 is that it was more that families were not aware of existent evidence-based methods to assess pain or intervene. It is just that they weren't aware. So the questions featured, but already there are answers to that question. We are not very good at implementing and sharing that knowledge across to families. That is what came out of that. Okay. So we've looked at what the priorities were when you had clinicians, families, young people, and charities together. So that's the Morris study. If you have not studied that one, I would recommend that you actually spend a little bit of time looking at that one. So what I'm now going to tell you a little bit about, and this is not published anywhere, is around what do people want to know about, what do people want to train in. So this is relating to a survey which we carried out back in 2016, late 2015, in early 2016, as part of the International Alliance of Academies of Childhood Disability program. Are you aware of IAACD? This organization called International Alliance of Academies. So just briefly to tell you a little bit about it. So like we have the European Academy, about 5 years back, around 2014, there was a move towards bringing together different academies of childhood disability to try and have a global perspective. Because yes, we are, in the European Academy, but we increasingly recognize that we have both a responsibility and connectivity across the globe. So the move was towards bringing together all the academies, and it started off with 3 foundation academies, the EACD, the American Academy, and the Australian Academy. And now there is a process 5 years on. We now have multiple other academies joining. So you've got the East African Academy, the South African Academy, the Latin American, Mexican, Indian Academy, the Chinese. So everybody coming together now to have a shared platform. So one of the subgroups within the International Alliance, we have a Global Professional Education Committee, or the GPEC. And I've been chairing that committee for the last 5 years, from 2014. And when we set it up, one of our first priorities was to find out what is going on and what do people want. So we had this international survey, and we had people from all over the globe. We had over 1,000 responses, and they told us what kind of collaboration is going on. And the second bit was, what were their priorities for knowledge? Yeah, what training did they want? What kind of material did they want? Was it net-based? Was it paper-based? Et cetera, et cetera. And based on those responses, I'm going to show you some of the training priorities, which will hopefully help you understand what some of the research priorities should be as well. And the second bit was that most people told us they wanted net-based information and also some face-to-face training. So based on that, we have an International Alliance website, which we are working on, when we hope to inaugurate in the AACPDM meeting, which is the second International Alliance meeting in Anaheim in September. So that's going to come live as a source of resource, and we would hope to have a lot of resource on there, which is evidence-based or good practice, both teaching and training material, but also articles, and we want people like yourselves contributing stuff into it. Yeah? So through the day, I'll catch you guys and give you more detail about how you can get involved in that process. Okay. And as part of that also, we are running workshops across various areas of the world. We've run some in Georgia, we've got some going on in Mexico, we ran one in Paris. Did any of you attend the Paris one? No. But there's some more coming up in India, in East Africa, etc. So that's the sort of hands-on training which we are delivering. So we had about 600 responses to what the training needs were. And when we analyzed the data, we kind of categorized it into 3 main groups: the condition-specific priorities, the content priorities, and process priorities. And what do we mean by that? Oops. These are the conditions, and this is no surprise. These are the conditions people wanted to know most about: cerebral palsy, autism spectrum disorders, neuromuscular disorders, ADHD, and sensory impairments. There was a long list of conditions, but these were the top 5, and by a mile, cerebral palsy was way above any of the others. Okay. The content priorities were huge, and this just gives you a flavor of what people were wanting. And I've categorized it into these areas. You will notice that apart from the obvious, which is therapy-related training needs around CIMT, new treatments, etc., people wanted to know about typical and atypical developments in their own context, within their own populations. They wanted to know more about advocacy issues. Of course, they wanted to know about assessment tools and functional scales. What you will also note that there was things around communication for parents, teachers, etc. And last, the third category was the one which interested us most. And these were the process priorities. And you will notice that there are many in there. Themes related to improving participation and independence, understanding underlying concepts around that. So essentially around the ICF model, family-centered service model, transdisciplinary care models, critical appraisal, research methods, etc. Prevention of disability, transition issues, and CBR or community-based rehab. So when we looked at the training needs, a few of us involved in that group. So when we started that GPEG group, we had 7 members, and now we are up to about 14 members within that group. So when we had that data, there were 7 of us, and we mulled over that, and we've been thinking through that, and that then led us on to thinking about what are the foundational concepts which underpin current practice in the 21st century. And I think that's where the topic comes from, which is the toolkit of foundational concepts. We haven't called it a toolkit, but we think these are important ideas that we need to share and think about, and which should formulate some of our research priorities. Okay. So what have we covered? So far, we have looked at what are the outcomes that disabled children want for themselves as positive outcomes. We have looked at what parents want for themselves as positive outcomes for the parenting role. We've looked at briefly what service providers want out of their service. We've looked at research priorities when you put only professionals together globally, and also research priorities when you have a collaborative model across families, and a bit about what are the training needs globally. Yeah? Going through the day, and as we cover more, I want you to reflect on how it will influence your own research going forward. Yeah? I know most of you, by the dint of the fact that you're here, are experienced researchers. You already have a track record, that's why you're here. Yeah? You know, you've qualified and you've gained a place here. So actually, one of the aims of the ACD is to influence that, you know, the brilliant young researchers in Europe, and also to create a network. So going forward, you know, you are the people with these friendships and the networks. We hope to build a very strong research base, and that is one of the main focus that EACD has. So, for this session, if there are questions before we move on to the next bit, any questions? You can raise a finger. Any thoughts? We're running a little bit late. Yes, Veronica. Sorry, hang on.
In relation to the last question, I think, in my opinion, it is very difficult to research and cover all these needs. So if I think about my research, it's so small that I cannot try to solve the big research questions. So that's my point. It's quite difficult.
You're absolutely right. It is very difficult for us as individuals working within one unit to be answering a lot of the questions, which is why we have taken this slightly different model. We think it's organizations like the EACD, like the International Alliance, who have to take the priority, raise the issue, and facilitate. So this summer school is part of that direction, that we need to build up these alliances by which we can facilitate. We need to be able to do that. It not only requires money, it requires a huge amount of manpower, resource to be able to do that. But most importantly, it's the strategy. People have to give the strategy and build it, and then get people in and enable it. So as part of the GPEC group, we are looking at the training, but there is another group, which is the best practice subgroup within the International Alliance, and some of the work that they will do is facilitate the important research questions. And we would hope that all of you will get involved in the process, both because they're very interlinked, in terms of what is best practice, what are the research questions, and what are the training needs. They're very, very interlinked. So we are working closely together. But it's a very important observation that it's very hard to conceptualize or tackle these bigger questions.